Do you know your genetic makeup? Yeah, me neither. But wouldn't you like to know if you had any type of chromosomal abnormality? In the world today, you will see there are many defects that you can genetically obtain, such as Down syndrome, blindness, autism, bone defects, and many others where that came from, including the published case study of ASA. The case study of ASA, the medical name being argeniosuccinic aciduria, discussed a 3-day-old patient that doctors ran multiple tests on and determined that the patient had ammonia accumulating in his blood. If not treated and maintained swiftly and properly, the biological defect could have a fatal outcome. In 2002 case study titled Neonatal Transport, a 3-day-old neonate with hypothermia, respiratory distress, lethargy, and poor feeding, Monica Joseph and Joseph R. Hagman say, doctors learned from the test that the infant could possibly have hyperammonemia, which is a disturbance in the metabolic process and leaves an excess of ammonia in the blood. They came to the conclusion that this could be the diagnosis because it is most commonly found in premature infants, and the 3-day-old was born at 37 weeks gestation. But it went deeper than that. This is when doctors learned that ASA is inherited through an autosomal recessive defect, which is when 2 copies of an abnormal gene are present and then they develop, creating this birth defect. For example, a set of parents that I personally know are both carriers of cystic fibrosis genetic defect, but neither of them have the disease. They were unaware that they had the genetic defect, so when they had children, they then passed the genetic defect to both of them, resulting in both of their children having cystic fibrosis. This is what happened to the 3-day-old infant. He gained 2 of the same abnormal genes. When combined, gave him the arsuccinic aciduria disease. Normally, it is deadly, but caught in its early stages, it can be treated. Once the doctors learned that hyperammonemia and ASA are very similar in accordance to symptoms, they were able to find a treatment. The doctors began a hemodialysis treatment. This treatment is the quickest and fastest way to remove ammonia from the patient's body. After the treatment, the patient needed to go through maintenance therapy, which is where the patient has a protein-restricted diet, a supplementation with citrulline and arginine, and medication. If these methods still do not correct the problem, the infant will need to be registered on the national database list for a liver transplant. This will get rid of the enzyme deficiency permanently. Even the strangest case of illnesses can be treated in some way. The 3-day-old infant went through more obstacles that could have been fatal, but the doctors took care of the situation properly and began slowly bringing the infant back to health. The most vulnerable information that I learned was that knowing our genetic makeup, we can have defects. Some can be fatal and others are not. But all over, we cannot control our genetic makeup.